Domestic violence are used for one purpose and one purpose only, to gain and maintain total control over you. An abuser doesn't play fair. Abusers use fear, guilt, shame, and intimidation to weigh you down and keep you under his or her thumb. Your abuser may also threaten you, hurt you, or hurt those around you. Domestic violence and abuse does not discriminate. It happens among heterosexual couples and in same-sex partnerships. It occurs within all age ranges, ethnic backgrounds, and economic levels. And while women are more commonly victimized, men are also abused, especially verbally and emotionally, although sometimes even physically as well. The bottom line is that abusive behavior is never acceptable, whether it's coming from a man, a woman, a teenager, or an older adult. You deserve to feel valued, respected, and safe. Domestic violence symptom. Domestic violence may lead to both physical and psychological signs and symptoms in the victim. Victims may have obvious physical signs of traumatic injury, but they may also complain of non-injury signs and symptoms, such as chronic abdominal pain, that may seem unrelated to an abusive relationship. Family and friends, even co-workers, may see the following signs and symptoms. You may recognize some of them if you are a survivor of domestic violence. These are also signs that doctors look for in assessing potential victims of domestic abuse. Recognizing the signs and symptoms of domestic violence begins by observing the behavior of both the abuser and the person being abused. The abuser may appear overly controlling or coercive, attempting to answer all questions for the victim or isolating him or her from others. This type of behavior may occur in the context of a visit to the doctor where the abuser refuses to let the victim out of his sight and attempts to answer all questions for the victim. You may even note emotional abuse actually taking place. In stark contrast, the person being abused may appear quiet and passive. He or she may show outward signs of depression such as crying and poor eye contact. Other psychological signs of domestic violence range from anxiety, depression, and chronic fatigue to suicidal tendencies and the battered woman syndrome, a syndrome similar to the post-traumatic stress disorder seen in people threatened with death or serious injury in extremely stressful situations. Domestic violence treatment. A no-violence contract that specifically states there is to be no violence between the parties, and that should they become violent, they must report this to the therapist within 1 day. Part of the no-violence contract would also include no threats of violence. The batterer may be required to begin work on his own of some kind, individual therapy, anger management classes, group therapy, to begin to address his anger problems, perhaps including attention to physiological signs, relaxation therapy. There is a safety plan in place for the victim, which spells out under what circumstances he will leave the home. The therapist should meet individually with him to spell out a safe place to go. A friend or family member who knows the relationship has been violent, and this place should remain secret from the batterer. Domestic violence is a common disease, yet every individual needs unique treatment and care. We encourage people with domestic violence and their families to learn as much as possible about the latest medical treatment and approaches, as well as healthy lifestyle choices. For more information about domestic violence and how to treat domestic violence, just click on the link at description or visit www.mainmd.com. Thank you.